Hi guys, one of the ways Labour is maintaining its lead in the polls is by not promising to do things that they can't deliver. We can argue whether it's good for Britain or not, but politically it's a very clever strategy. Because on the other hand, you have the Tories making massive promises in regards to the NHS. So this week they said they would invest £1 billion in extra GP appointments. So back in 2019, Boris Johnson promised to build 40 new hospitals. This of course was a lie. But it seems the likes of Victoria Atkins haven't learned that if you tell people you'll do something and then don't, they'll be less likely to vote for you, especially if that promise comes just weeks before a general election.
What about the 40 new hospitals that Boris Johnson promised? Because we've checked the numbers on that. Only the National Audit Office said only 11 of them would be deemed as technically being new hospitals, and only a handful of them have opened. So why would people believe your promises now when that huge promise that Boris Johnson used to get the crowd to chant, that has not been kept?
So that promise was made in 2019. The pandemic hit us pretty much immediately afterwards. Clearly, both the NHS and the construction industry were affected by that. But as soon as we were able to, we got building again. We have 6 new hospitals open to patients today. We have 2 more opening by the end of the year, and we have 18 currently in construction.
Which hospitals? You notice that she never mentions which hospitals. She could actually name a hospital. This is a new hospital. That is a new hospital. Give us some names so we can actually investigate to see whether they actually are hospitals. They're new hospitals, I should say. Because a lot of them were already planned for reconstruction. Some of them are planned to be closed and reopened. Others are just being upgraded. But you notice she won't name the hospitals, because it would be very easy if there are actual new hospitals that she say, this is a new hospital, and give us the name. But she won't. Now, as I said at the beginning, what they're trying to do is, once again, lie to the public, convince them, look, if you vote for us, we'll invest in the NHS. We haven't over the last 14 years. We haven't sufficiently invested in the NHS over the last 14 years. But if you vote for us now, we will. The latest promise is, along with the 40 new hospitals, is an extra £1 billion for GP appointments. Now, GPs are already rushed off their feet. GPs are working overtime. And the Tories are saying, well, what we're going to do is invest more money for more GP appointments so that people can access a GP. Now, you've had 5 years since Boris Johnson was in charge, 14 years since you took over from the Labour Party, and you're saying now, at this last moment, a few weeks, literally weeks before the general election, we're going to invest £1 billion if you vote for us. See, I keep saying, if they actually done stuff and could show, when they said back in 2019, we're going to build 40 new hospitals. Okay, let's say they couldn't build 40 new hospitals. Then be honest about it and say, look, we're not able to build 40, but we built 20. And show the 20. Name them so people can see, okay, you've actually achieved something. But instead, it's always about lying to the public. We're going to do X when they have no intention of doing X, hoping that the public will either forget or that they can be confused into thinking that there are 20 or 40 new hospitals. Like a bit of, a lick of paint on a gate is not a new hospital, but that's what they're trying to do. Their definition of a new hospital is quite vague. And they were able to get away with these lies in the past, but people have woken up to this. People are looking around and saying, we aren't seeing new hospitals. If there are new hospitals, then why are people having to wait so much on to get a medical appointment? Or where, people need to get operations or surgery. Why are they having to wait longer? If there are all these new hospitals and all these new doctors and nurses, then shouldn't the waiting list come down and not go up? But once again, it's about lying to the public, telling them something, hoping that they will forget by the time the election rolls around. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.